Hey guys, welcome back. So I've been seeing a lot of questions online about healthcare in Albania. So if you're an expat, maybe you recently got here or you're thinking about coming here, or maybe you're Albanian and you want to know how this compares to other places such as Canada, this video is for you. So before we begin, just a disclaimer, I've just been compiling a list of researches, and I've been fortunate enough myself also that I haven't really needed to use the healthcare. But what I've been doing is I've basically went through a whole bunch of different websites, resources, forums, and gleaned a lot of the information and experiences that people have shared, and I put it all in one spot here in this video. So let's begin. Okay, so let's talk about just the basics, finding a family doctor. So in Canada, as most of you know, it says here on my research that I did that a referral is needed in Canada. I know that to get a family doctor, it's very difficult. The last time I had a family doctor, I was referred by a family member. So I don't know if that's what they mean, but and I was pregnant, so that was well over 20 years ago. Today, it's so hard getting a family doctor that, especially if you don't have underlying medical conditions, it's really difficult. I was on a wait list. We were in Canada for 3 years. I was on a wait list and I have yet to hear back from them. As of April, I left in April. So it's really hard. If you want to get medical attention, you go to a walk-in clinic. The wait times there quite long, and that's even if you get seen. We went a couple times. She got seen once, and that one there we waited. It wasn't too bad. It was about an hour maybe. We went a couple other times and we were turned away. They were overbooked. Alternatively, you can go online and do an online appointment, which is fine unless you actually need to be seen. So that's Canada. The wait time for that can be same day if you're not picky and you just grab any doctor. Otherwise, it could be anywhere from 2 days to a week. So is a referral needed? Yeah, I guess, kind of. You know, you can't just call them up in the yellow pages. Nobody's accepting patients. So you kind of got to know somebody to get you in. Cost, well, standardized healthcare. So healthcare in Canada is free. And free. You pay for it in your taxes. And then booking, you would call, you can call the clinic, the doctor's office to book your appointment, or you can also do it online. So let's see how that compares to Albania. So here, the wait time, often same day, but it can be 1 to 2 days. Is a referral needed? No. How much does it cost? It says here 20 to 35 euros for private. And for the sake of this video, it will be privately. So without health insurance, how much does it pay a la carte? In Tirana, you'll have a lot more English speaking than you would obviously outside, and also there's a lot more when it comes to medical. So from what I've gathered, outside the city is a little bit more difficult than in the city. So it's amazing, like you could see here, just getting in to see a doctor is quite a lot more easier here. All right, next up, let's talk about seeing a specialist. Okay. So the specialist, this is where that big difference comes in. And this is the shocking one, okay? So for example, the wait times and the process, both of them, right? So for example, in Canada, if you need to see a specialist, that can take months, okay? Like months. Here, you get it within days. So for example, and you need a referral from a doctor, okay? So for example, well, I needed to see a specialist for my eyes and I couldn't just book directly with them. It actually had to be booked from an optometry office. So I had to go see an optometrist, and then from there, they refer me. And it took so long. I went to see them in January, and by the time I actually got my appointment, I was already in Albania. So I haven't even seen the specialist because it took over 4 months to get that appointment. And that's just for my eyes. Can you imagine other stuff that is more in demand? We'll cover it. So in Canada, the wait time to see a specialist, depending on what you're doing, is anywhere from 1 to over 6 months. Okay, let's do side by side. In Albania, if you need to see a specialist, the wait time is 1 to 5 days. Is a referral needed in Canada? Yes, you cannot book directly. In Albania, no. So you can just contact a specialist, make your appointment, go do you boo. And then of course you're gonna have to pay for it. In Canada, it is free, but you get what you pay for, which is nothing. And Albania, you're looking at about 30 to 50 euros. Now, personally, I would rather spend 30 to 50 euros and see somebody than spend nothing and be waiting, right? Now, I'm pretty sure that if in Canada people had the option of paying $40, let's split the difference, spend $40 and see a specialist within days, that they could just reach out and contact themselves, they would be all over that. So I'm often asked, even I've had students ask me in class, you know, about the healthcare here. Like, oh, it's so much better in your country, isn't it? And I'm like, at least you get to see a doctor. So the medical equipment and stuff, from what I've heard, is not as advanced. More so, it's better in the city. Again, the further out you go, the less it is. But I would rather see a doctor with old equipment than not see a doctor at all. Prescriptions. A lot of people ask, can they get their medications in Albania? The short answer to that is yes. Okay. In most cases, anyway. So there are pharmacies everywhere. Okay, I was gonna say you can't throw a rock without seeing one. Where I am, I'm kind of tucked away, but just at the bottom of the hill here, there's about 5 of them. So you don't always need a prescription. In Canada and America, you need a prescription for more things than you do here. It's more regulated than it is here. But you still need a prescription for basic stuff like antibiotics and that kind of thing. So let's see here. I've got a comparison. It says OTC meds in Canada, it's limited. In Albania, there's many available. So we have, I should have brought the box with me. So we get ibuprofen, here it's called Nuprofen, and I get paracetamol, which is like Tylenol. The Nuprofen is 400 milligrams, the Tylenol is 500, and it's just generic brand. And she also had naproxen, so for those of you who take a leave, they have that here as well. And then for our lizard, we needed to buy some stuff for her because she was starting to get tail rot, so we needed an antifungal cream, so we got that. It was no problem. So most of the stuff they have here. So the refill prescription needed in Canada, yes, it's strict. Here, often it's not needed. I did inquire about antibiotics, and she told me that they did, but from what I've read online, depends on the pharmacy. But I mean, still, it's not hard to see a doctor and get a prescription. So refill process in Canada, you need to see your GP or go through the app. Here, you can ask the pharmacist or see a private doctor. Cost in Canada. So here's the thing with the pharmacies in Canada. I don't know how it works in the US. I'm assuming close to the same. I don't know. But even though it's free, you still have to pay a dispensing fee. So you're paying a minimum of like $10, might have gone up by now, but you pay a minimum of $10 and that's your dispensing fee. On top of that, you pay for your medication. So here, total, it's about 2 to 10 euros, depending on what you're getting. It's not as expensive as back home. So of course, now things like controlled substances, like ADHD meds, narcotics, those are still tightly controlled here. So you want to bring a supply of it and a doctor's note if you need those. So for us, Summer brought escitalopram, and for anxiety. And we brought a 6-month supply before we left. We haven't had to refill them yet because we've only been here for 4 months, and she still has a couple months left because she already had, we're at about 7 months here. So when we refill that, I'll definitely take you through the process with us and you can see how that goes. Let's see here. So next, dental care. This one is huge, especially when you're looking at cost comparison as well. There's dental tourism here. Okay, so basically where people come here to get their dental work done. So this is a big difference between Canada and Albania, because in Canada, even with medical insurance, it's expensive. And you got a cap. So I know mine was $1,500 for the year, which, okay, fine. But if you need to get dental work, that adds up quickly. So you can get 1 or 2 teeth repaired, maybe, depending on what you're doing. Sometimes it's just 1. So I'll give you some cost breakdowns. And also the clinics here are pretty clean. They're not sketchy. So cleaning in Canada, you're looking at 150 to 250. That's just for cleaning. Here, 30 to 50 euros. A filling, you're looking at 200 to 400. In Albania, 20 to 50. Implant, if you wanted to look at doing implants, you're looking at anywhere from 3 to 5,000, and here you're looking at 800 to 1,300. So as you can see, huge difference. And like I said, I've read online, people have got work done here and they're ecstatic with it. So, and again, dental clinics you see everywhere. They're almost as prominent as pharmacies. So eye care. So for glasses, you can get your eye care done here. It's really cheap. It's less than the cost of dinner out, and within a day or 2 you get your glasses. So same thing, you can walk in, you can contact them on WhatsApp. Next up, mental health. So it's still developing here, okay? So the stigma is still there with mental health. It's mostly private, and but the costs are a lot lower than what you would pay back home. It's actually affordable here. So for public therapy, the wait time in Canada is really, really long. Really long. I wanted to get someone for summer. She's got social anxiety, plus the whole moving back and forth. I thought it'd be great for her to have somebody to talk to, just to make sure, And again, that was 3 years ago. We're still waiting. The wait time for mental health in Canada is insane. Especially, I think, also keep in mind this is all post-COVID. I'm sure that has something to do with it, but nonetheless, the wait time is too long. Here, it's not really available. So if you want, you have to go private, okay? And in Canada, highly advised, again, you have to go private. If you want to see somebody more, like if you really want to see somebody, you're better off paying privately rather than going through the public healthcare system. And that's the issue, is how expensive it is, right? So let's take a look here. So in Canada, private therapist, you're looking at about 150 to 200 per session. If you're lucky, you might find somebody for 100, but when I looked, I think it was my benefits, my work benefits covered some. I would still have to pay 50 out of pocket for 4 sessions, I want to say, and then after that I have to pay full. So it's basically, what's 4 sessions? That's your warm-up. Anyway, here it's $30 to $60 per session. And by dollars, I mean euros. So I think I'm saying dollars, but it's euros here. So 30 to 60 euros per session. Availability, it could still take you months to book in. Okay, so it's not super long like the private one or the public one, but it's still months. And here you get it within days. So it's a lot cheaper, and the wait time's astronomically less. And again, one of my students at work is a psychologist, and she's learning English. So there definitely are some English speaking psychologists out there. So what to do in case of emergency. So first of all, let me start this by saying emergencies in Albania, to the equivalent of 911 would be 129, and that'll get you police. 127 would be an ambulance. Okay, so the response times here are a little long depending on where you are. In the city, you're looking at about 20 minutes. Is the wait time 15 to 20 minutes on average, depending on where you are. As you go outside the city, further out, you're looking at 45 minutes plus. Okay, so most people just go directly to the hospital. And again, private hospitals, well above and beyond, you know, public. So in Canada, you're looking at 15 to 45 minutes. And here, 15 to 20 minutes in Toronto, 45-minute plus in the rural, pretty much the same as Canada. ER wait times in Canada. This one hits home. So Summer had injured herself, little backstory. Summer injured herself. It was New Year's Day. And she hurt her leg. And we went to the ER to get x-rays and, you know, see a doctor. We waited well over 8 hours and finally left. The wait times I've heard are 12 hours. I mean, you can probably get in some places, you know, let's say 6 hours, where we were. No, maybe other places you might be able to find something that's 2 hours or more, 2 hours or less, I don't know. But where we were, and it was just an hour outside Vancouver, okay? Like, I wasn't in the middle of the woods or nothing. And that hospital have turned people away. There's been stories online of people having heart attacks, getting turned away. Further out in other little rural areas, a woman was in labor and she was told to drive to another hospital. They couldn't take her. That's healthcare in Canada. So here, the ER wait times in Toronto anyway, in a private hospital, you're looking at 30 minutes to 2 hours. So Canada cost is free. And here you're looking at 50 to 100 euros. So one of the stories online, she was in Vlore, I believe, and she was saying that she didn't pay anything for the hospital visit, and she had an MRI appointment scheduled for the next day, and she paid 120 euros for that. So, yeah. Okay, now health insurance and costs. If you're an expat, you'll probably want private insurance, okay, or pay out of pocket for care. It is that affordable here, okay? So if you're living here long term, you can register for public insurance too, and we'll cover that in a minute. So the public system, Canada is tax-based, and in Albania it's for residents only, and also tax-based. Private insurance, optional in Canada. Here, recommended for expats. You also need it for your residency, and you need it for certain visas. GP visit with insurance is free. So if you go to see a doctor in Canada with insurance, it's free. Here, it's either free or $5 to $10. Without insurance, it's still expensive in Canada, and here it's still affordable. So basically the differences in healthcare between Albania and Canada, wait times and affordability. Now, with that said, what I've gleaned from my research is that in Albania, the equipment is older. And another thing too is that there's a tipping culture when it comes to medical care. So by tipping doctors and nurses, you can elevate your care, basically, where they take better care of you. Is it required? Absolutely not. But it's something that has been done here. Okay. So I have zero experience with this. I'm just relaying what I found. Do what you want with that information, or, you know, feel free to look into it a bit. If you have any experience with this, by the way, let me know, because I think that it's good to know these things, especially when you come here as an expat and you have no idea, right? Okay, so there's that. And the other thing too is, again, the equipment is a little bit older, but again, like I said, I'd rather have older equipment than no doctor or having to wait. How to book appointments. This one I thought was one of the crazier ones. You don't need a referral. You just contact them. And another thing too is you often get to dialogue directly with the doctor. Okay, so when I say contact them, it's usually the doctor. And this here, I didn't really think of it because it's like this in China too. And I was like, oh yeah, that is what we're doing here. Same thing with the vet clinics. Okay, we dialogue with the vet directly. If I need to book an appointment, I speak to the vet. I'm not talking to the secretary to book an appointment and all that. I'm directly with the vet. Boom, okay, I'll meet you there at this time. We've sent videos of Ruth and been like, you know, is this okay? Is this normal? And he'll, over the phone. And if it's like, oh no, she's fine, don't worry about it, he'll say that. Or he'll be like, oh, that's concerning, bring her in. It was like that in China too. So China's also like that. Dude, people talk about how great healthcare is. In China, we had this amazing vet, okay? And you think, rural, tiny, little place in China. And we had this amazing vet. And when we went to Canada, Joey had allergies. So he ended up ripping his eyelid off. It's terrible. And that's why my dog's eyes are weird now, because he's missing eyelids. Anyway, so we ended up bringing him to a clinic. They gave him this shot that he reacted negatively to. He's allergic to as well. And it made him so sick, he was lethargic. And so we brought him to a different clinic. And that vet was like, oh no, he's fine. I can't do anything for him. You need to get blood work done to find out what he's allergic to. I can't do anything. And I was like, well, how much is that? And he's like, it's $700 plus, you know, the other cost. And I was like, what? He needs gravel. He's puking. He can't hold anything in. Like, just, and he refused to do anything. So I reached out to the vet in China, and over WhatsApp, the vet in China was like, okay, give him some gravel. This is what you do. This is how much you give him. What's his weight? And he totally helped me. And I still have Joey today. If it wasn't for that vet in China, my dog might have died thanks to Canadian healthcare. So when people ask me, how's the healthcare in Albania compared to healthcare in China? I have zero faith, or in Canada, I have zero faith in Canadian healthcare. Whether it's a vet or a doctor, I have zero faith. The healthcare in a little rural town in China is better than the healthcare for people and animals that we receive in Canada. That ER visit, by the way, Summer ended up getting a bill from the hospital for that x-ray she did for a couple $100. Why? Because she said she hurt herself while she was, no, she didn't say she hurt herself while she was working. She said she's been working a lot of hours and her feet hurt. So because she said the word work, it's now a working compensation claim. It's no longer covered by the government, and now we need to pay for it. This is what? This is your care for people? That's Canadian healthcare. It's mind-blowing. That's Canadian healthcare. So, if you are Canadian and you're watching this, you'll get better care here. If you're Albanian and you're watching this, at least you get to see a doctor. So, if you have more medical problems, definitely you want to stick closer to the city rather than living further out. Anyway, so I kind of went off on a tangent there. Basically, what to bring with you if you move here. Okay, so medically speaking, if you're planning on moving here, things you're going to want to bring with you, your printed prescriptions. So they have that, a list of the generic names of the medication you're on, And if you can get a copy of your medical records, then you could bring that here, and then they'll have it. So it's good to have. Also, your insurance documents, a doctor's letter for controlled substances, and it'll help cover you on some basis. So let's say you get your residency permit, okay? Now, how do you access the healthcare here? So from what I've researched, and I'm still figuring this out myself, I made notes. You'll need to register with the public healthcare system before you start getting your basic coverage. So first you get your residency permit, okay? And then you need to bring that to a government office, ADISA, or the National Business Center. These are what they call one-stop shops. So you can register for various public services. At that office, you'll need to show your residency permit and also proof of health insurance. So that's why I said it's definitely needed. So once you've done that, you register with Compulsory Health Insurance Fund, the CHIF. You'll get a health insurance card. This card is important. It's your key to accessing all these services. So that's the basic route to accessing public health care once you have your resident permit. I haven't started that yet because I just got mine in June, and then my school shut down and I wanted to get information on, okay, so where do I take this? Anyway, so I was like, I'll just wait till September, and that's where we're at. So I'll be getting that registered soon. Something I'm going to share with you is this, and this is for those of you who stayed to the end and watched it all. An important tip is this. I read this somewhere and I was like mind blown. Whenever I share this with people, they're like, oh, that's really good. Right? Okay. So basically, if you want to know how healthcare is in a country, take a look and see at how many people are retiring there. People aren't going to retire to a country with shitty healthcare. Okay? And that's the thing, especially when you're coming from a place like Canada, America, UK, Italy, somewhere where it's known to have good healthcare. If people are leaving there and retiring to, a certain country, obviously the healthcare there has to be good. At the very least, offering something their country isn't, because they wouldn't be moving there, right? So, a little food for thought. There's a lot of people from America retiring here, Canada. I was talking with one of my students and he was mentioning a lot of people from Italy are retiring here as well. So when you factor in that a lot of people are coming here and retiring here, it's a true indication on how the healthcare really is. So I understand that there's some controversy with it, and I'm not saying that this is, amazing healthcare. It definitely has a lot to be worked on. But for me, the fact that if I need to see a doctor, I can, and I don't have to wait 6 months, it's a bonus. Even if you don't have, or if you're American, right? You guys know this, and you don't have insurance, you can still go see a doctor and not go in debt. So you don't have to decide every month, do I pay my medical bills or do I eat? It's actually affordable here. So if you have medical conditions, definitely you don't have to stay in Toronto, but definitely the bigger cities rather than more rural areas. And yeah, Toronto is the capital, so it's going to have, the better hospitals, better doctors. Also, the other thing that I've gleaned is that for small, like normal stuff to intermediate, you're fine here. But if you have healthcare problems that are above and beyond that, then you're going to want to start looking at going abroad. So it depends on, so yes, the healthcare here is good up to a certain point. If you have something that's more serious, then it's not recommended to be here. People do leave and go to other countries. So you're going to want to go abroad for that. But for normal stuff, regular stuff to intermediate things, you're fine here. I hope that this gives you a better picture of healthcare here compared to back home in Canada. And I hope this answered some questions that you had. So if you have any more questions, list them down below. If you have any comments, down below. And looking forward to hearing them. All right, until next time, bye.